In this video, I want to talk briefly about the different types of mental disorders. There is an enormous number of mental disorders, many of which may have overlapping features. For most categories of mental disorders, there is usually a stipulation that the mental abnormalities are not due to the use of medications, substances, or another medical condition, in which case the mental abnormalities are considered to be symptoms of that underlying cause, rather than a mental disorder in and of itself. Also, because features of mental disorders often overlap with mental and behavioral aspects of some people considered to be within the bounds of what is normal for a person's culture, another general consideration is that the mental abnormalities cause distress or disability. Distress or disability. Distress or disability. And this is a key point because that means that a person that's just unusual or eccentric does not have a mental illness. So that a person that's a little weird is not mentally ill. So to give a very superficial overview of the types of mental disorders, I'll go through some of the top-level categories. And recall that there are two main systems in use currently to categorize the mental disorders. There's the ICD-10 from the World Health Organization, and then there's the DSM-5 from the American Psychiatric Association. And I'll go through the categories of the DSM-5 just because I'm a little bit more familiar with that system, but there would be a lot of similarities between the two systems. The DSM-5 has 20 top-level categories, and I'll start with the neurodevelopmental disorders. These disorders involve distress or disability from an abnormality in development of the nervous system that causes mental dysfunction. So let me just draw a little baby here. Let me just draw this little guy, and we'll put some diapers on him to represent a developing nervous system, and particularly a developing brain. And there's all sorts of things that can happen to the brain during its development that can lead to abnormal mental function. Some of the disorders in this category of neurodevelopmental disorders include intellectual disability, which was previously called mental retardation. The autism spectrum disorders are in this category, and attention deficit hyperactivity disorders are in this category. Like all the other categories of mental disorders, there's also a group within the neurodevelopmental disorders called other neurodevelopmental disorders, for any that don't fit all the criteria of one of the specific disorders in this category, but when this category is the best fit for the disorder. So I won't mention that again, but just keep in mind that every one of these big categories has an other category at the end of it. The next big category is called the neurocognitive disorders, which involve distress or disability from the loss of cognitive and often other functions of the brain after the nervous system has developed. So let me just draw a little old person walking along, walking with a cane. And the distinction here between these neurocognitive disorders and the neurodevelopmental disorders is that with the neurocognitive disorder, the nervous system developed and then lost functions, as opposed to the neurodevelopmental disorders, where usually the function was never gained in the